And management of diabetes is multifactorial. It has to be started from lifestyle management. Diabetes basically is a lifestyle disease, and we can postpone diabetes by 10 to 15 years if we are careful. Regular exercise, that means at least 5 to 6 times a week. If we go for a brisk walk for at least 30 to 45 minutes, that not only makes your body fit, you feel better, but it also reduces the chances of getting diabetes, it reduces the chances of getting high blood pressure, and even if you have high blood pressure, the amount of drugs which you require becomes less. Even if you are a diabetic, the number of drugs you require becomes less, the dosages can become brought down, and some of the complications of diabetes can be minimized by good lifestyle. That means maintaining weight, bringing the weight to normal levels. That means very often diabetic patients are obese, so reduction of weight is extremely important. And the best form and best way of reducing the weight is by exercise and diet. Eat more of healthy foods like fruits, vegetables, salads, and not foods which are not greasy, foods which are low in oils, and sugars in all forms should be avoided, especially very refined sugars should be avoided, ice creams and pizzas and these things, because they get very quickly absorbed. If one is taking fruit, it is better to take the fruit rather than the juice of the fruit, because if you take fruit juice, it is concentrated sugar, and the moment it goes to the stomach, it gets absorbed, and you have a peak of blood sugar coming within 5 to 6 minutes. But if the fruit is taken, it has got a lot of roughage, it reduces the absorption of sugar, it evens it out, and also the roughages and the other parts of food has antioxidants, fiber, vitamins, minerals, which are missing in the, if you take it as a juice. So fruits are very good, and the fruits like citrus fruits, apples, pears, uh, apricots, these are much better fruits which are a lot of fiber. Mangoes, bananas, these are very rich in sugar foods. They should be not taken in big amounts. So that about the food, and lentils and uh, cereals, they are much better than having matti, samosa, and foods made out of refined atta. Similarly, for rice eaters, it is better to take unpolished rice, rice which we used to eat in our villages. Very often it is brown in color. Once again, because the roughage in it reduces the absorption of sugars, and it has other good products which are healthy to the body. Then coming to, we talked about diet, talking about oils, because taking oils is also to some extent important, because we need some fats, and but these oils and fats also should be carefully chosen. The refined oils are not very good. Olive oil, mustard oil, these are the oils which are good. They've got a good amount of omega-3 fatty acids and monounsaturated fats, which are much better than saturated fats which are contained in butter and desi ghee and other things. It's not that desi ghee is totally banned, but very small amounts. You may just take it for flavor. But otherwise, these are the products which are highly saturated and increase the blood cholesterol levels. On one hand, we are trying to reduce the cholesterol. On the other hand, if you go on ingesting the cholesterol-rich products, you are counterbalancing it. The other thing to be noted is that the most of the cholesterol in the blood is coming from the liver. It's not coming from food. About 20 to 30% of the cholesterol is only which is going from food. Even if you don't take cholesterol at all, zero cholesterol, your blood cholesterol is not going to become zero, it's still going to be there. So one has to measure the lipids, and if the bad cholesterol is high, In that situation, especially if you have a high risk of getting a cardiac problem, which can be calculated by some simple scores by your physician, if the 10%, if there's a more than 10% risk of getting a cardiovascular problem in the next 10 years, or even 7.5% risk, in that situation, it is recommended that the drugs which reduce cholesterol, especially the statin group of drugs, should be administered in an appropriate dosage. So we talked about diabetes, diet, exercise. We also should know that diabetics sometimes get very low blood sugars, especially those diabetics who are on drugs. So one should also treat diabetes, but not very, very aggressively. So the patient should know what are the symptoms of hypoglycemia, because hypoglycemia is again a dangerous condition because it damages many organs during the period blood sugar level is very low. It can damage the brain, it can damage the heart. So initial symptoms of hypoglycemia is that you suddenly feeling very weak, start sweating, start becoming confused. At times you just faint if the blood sugar becomes very low. So anybody who is a family member of the diabetic should know what are the kind of symptoms of hypoglycemia or very low blood sugar, so that most people of long-standing diabetes have a very easy to measure blood sugar instrument at home. You just make a puncture and put blood, and that stick can be put into the machine and you get the reading. So immediately that should be done, and the person should be given some sugar, and especially these diabetics should have some candies or some rapidly available sugar with them, so that they just take it so that the hypoglycemia is aborted. And especially if a person for some reason is not eating food and is continuing to take the same dosage of drugs, then you are inviting hypoglycemia. So one should always see that if you are not taking food, should be careful. Maybe you don't take a tablet of metformin or whatever tablets you are taking that day, and consult your doctor if this is becoming a new problem for you, so that the drugs and dosages can be adjusted.